Hi everyone, it's me, Arielle, and today I want to talk about binging. I've done several videos in the past 3 years about binging. Did a couple of videos on how to eat when hungry and stop when full, and I also talked a little bit about cycles of binging, and I've talked about binging and purging together. But today I just want to focus on binging, and primarily what I want to talk about is in relation to that vicious cycle. I want to preface this video with saying that not everyone with an eating disorder struggles with binging. This video is primarily going to deal with binging and certain things in respect to binging. So I was asked to do a video on binging, and even though I've done some in the past, I did want to delve into it a little bit more in depth because a viewer asked me to, and I thought it was a pretty valid topic. What I mean by the vicious cycle that usually leads to a binge is when someone's struggling with an eating disorder and one of their behaviors is restriction. Oftentimes what happens is they will not eat for a period of days, or they won't eat much for a period of days. And even if they don't realize it fully, their body and their mind become so hungry that it leads to a binge. And then once they start to eat a certain food, they just can't stop. And it's because their body just wants that food so much. It can be about nutrients, it can be about sugar, it can just be about fuel, about giving the body those calories that it's been missing. Sometimes people will seek out certain foods they know that they will binge on, or certain foods that they just really like. For example, things that we would deem junk food, or things like candy or cake or chocolate or cookies, foods like that. Everyone has different binge foods if binging is a behavior that you use, but just for sake of example, foods that are sugary. I guess is what I want to say. And what happens is they will be giving in to that feeling of wanting that particular food, but then because their body has been so deprived, they just keep going, and it leads to a binge. Sometimes when people binge, it will lead to a purge. Sometimes people just have a binge eating cycle, and it's just restriction and binge and restriction and binging, and it doesn't have anything to do with purging. The thing that I really want to make you stop and think about for a minute is that this cycle I'm talking about doesn't only happen to people who are struggling with an eating disorder. It happens to people who are in recovery from an eating disorder. For example, if you have decided to take the path of recovery and you've decided to recover, you've chosen it, chances are you have some kind of a treatment plan, or some kind of a meal plan, or some kind of a team in place, whether that team is just your family, whether it's a nutritionist, whether it's a therapist, whether it's a medical doctor, maybe it's all three. It's different things for different people depending on needs, depending upon resources, what's available. But chances are you have something in place, and you might have a meal plan or a way that you're supposed to start living your life day to day in regards to food. And this cycle can unfortunately still happen because when people with eating disorders, for example, need to gain weight to be healthier, they are going through this process of refeeding their body or becoming used to a meal plan, sort of adjusting the way they live. And as you continue to eat and your body puts on weight, or you're eating more food or different food than you were eating before, there is usually a period of being very uncomfortable. Being uncomfortable in your own skin, being uncomfortable around other people, being uncomfortable when you look in the mirror, being uncomfortable in any number of situations, depending upon the person, depending upon the scenario. But when this happens, usually in regards to weight gain or reintroducing certain foods, you can become so wrapped up in that feeling of negativity that you compensate by restricting, because you just can't let yourself go that far. You want to recover, you don't want the eating disorder, but you just can't let yourself go far enough to say, you're going to stick to this meal plan, or you're going to keep eating these foods, or you're going to keep eating this number of calories and keep going and just push through that discomfort, because it's really, really difficult. And you're not alone if you feel that way, because I think it happens to most people when they begin to recover, or even farther along into recovery. But when this happens and the feeling becomes too much, many people will restrict. They'll pull back. They might not fast, but they will eat less than they should be eating, or they'll remove foods, or they'll remove certain parts of their meal plan or what they deem to be good food because it makes them feel better. And as they are making themselves feel better because they don't feel they're putting on the weight, or they feel more in control of the situation, they're depriving their bodies. And they don't realize it all the time because they're not going on a complete fast. They're still eating, but they're controlling it and they're being very strict with it. And it might feel good to them because they're missing their eating disorder in a way, even though they want to recover. And when this happens, you're more apt to binge. You are more susceptible to that binge vicious cycle because you deprive your body, you deprive your mind, whether you consciously do it or unconsciously do it, and whether you think you're depriving yourself a lot or a little, it can still happen and you're still susceptible even if you're in recovery. And once you start to do this, you might go for a period of a couple of days before you have that binge. You might go a period of a few weeks before you have that binge. It might be the sight of a certain food that triggers you into eating it, and then it just leads to a whole binge because you've been depriving yourself. It might mean that you've been quote-unquote good for so long in this controlled sort of eating that you are going to allow yourself a treat of a certain food, and when you do, you just don't have the control to stop, and it leads to a binge. The reason isn't you. It isn't that you don't have self-control. It isn't that you're bad at recovery. It isn't that you're stupid. It's that you have been depriving your body, and your body knows better. Your body wants more, and it doesn't know how to just slowly take in what it needs. When you give yourself a little bit of what you need, it's going to just keep taking it. So that binge cycle can happen even in recovery. And the first step is being aware of it. As soon as you're aware of that cycle, and you know that it's out there and you know that it can get you, then you can try to nip it in the bud. Binging is not going to be a behavior for everyone. It's not going to be a behavior for everyone with an eating disorder, and it's not going to be a behavior for everyone in recovery. But it's something to be aware of, because binging can mean different things for different people, and certainly people can go on a binge with food that isn't classified as junk food. It can be healthy food, or it can be nutritious food. But if you have that lack of control and you have that binge reaction where you can't stop eating, or you want to keep eating more than is considered normal or healthy, it's because you've been depriving yourself. And you really need to take a good look at if depriving yourself and restricting or holding back from the full recovery picture to make yourself feel better is really worth it. I mean, I of course can tell you it isn't worth it, but you need to figure that out for yourself. You need to assess, you need to examine, you need to do some self-reflection, and you need to take it one day at a time. Take it slow and understand that recovery is not an easy process. I want to talk about binging in a different respect now, in regards to eating disorder recovery. Sometimes when people are recovering from an eating disorder, they are actually doing very well with their meal plan, or very well with introducing foods and with eating normally and healthfully, and they may be uncomfortable with weight gain or with weight maintenance, or they may be fine with it. But either way, sometimes what happens is they miss their eating disorder. It might be conscious, it might be subconscious, but it can happen, and I think it happens to many people, whether or not you felt that your eating disorder was your full identity. You are essentially getting rid of something that has been a big part of your life, and it takes adjusting. It really does. So you can be susceptible to a binge because of this, and I'll explain a little bit about why. You may be doing exceptionally well in recovery, exceptionally well with eating, and with eating the right foods at the right times and in the right amounts. And in doing so, you are actually succeeding at recovery. with flying colors. And whether you realize it or not, it might be scaring you. And you might be worried about what this means, because the better you are at recovery, the farther your eating disorder is in the past. You're leaving it behind. You're leaving it in the dust day by day. It's getting farther and farther away from you. And that's a wonderful, excellent, empowering thing, but it scares a lot of people. And it's normal to be scared because you've held on to it. It can be a coping mechanism. It can be something that feels like a part of you simply because you've done it for so long. It can be like a habit. It can be like a tradition. It can be like a way of life. And you're letting go. And doing well in recovery means you're letting go of it. And sometimes, whether people are doing it intentionally or not, they will go to that food like candy or cookies or chips or whatever that food is for them, and they'll binge on it. And they're binging not because they've been depriving their bodies, but because they don't want to let go of the eating disorder. So they self-sabotage. And self-sabotaging is something that you need to be on the lookout for. Again, it won't happen to everyone, but it's important to be aware of these things, and it's important to ask yourself questions and see if you are doing any of these things so that you know why your binging is happening or if you're at risk for a binge. Something that's fairly common in recovery from an eating disorder is changing eating disorders. If you are recovering from anorexia, you can develop bulimic tendencies or binge eating tendencies. If you're developing from binge eating disorder, you can develop bulimic tendencies or anorexic tendencies. If you're recovering from bulimia, you might develop anorexic tendencies. You may find yourself being drawn to behaviors that you didn't have before, and in recovering from one disorder, sort of trickling into the territory of another one. You're not alone. It happens a lot. It happens a lot more frequently than you might think, but again, you need to be aware of it so that you can stop it from happening when you recognize the signs. And because you have sort of transferred your habits, your behaviors, your problems and coping mechanisms from one eating disorder to another eating disorder, doesn't mean you've recovered from one and now developed another one. It's all the same demon. It's all the same seed at the core, and you are swapping. You are swapping behaviors and tendencies, and your brain's not fully healed. You're not fully healed yet, and you need to give yourself time to heal, and you need to know what to look out for. It's important not to go into it with fear, not to go into recovery from anything with fear. There's always going to be some element of fear. It's scary letting go of something. It's scary adjusting and taking on new, healthier habits, changing your lifestyle, changing your way of thinking. When you change your whole mindset, there's going to be some fear involved, and that's perfectly normal, and it would actually be more abnormal if you didn't have some fear. But don't go into recovery expecting fear, and don't go into recovery with fear being at the forefront of everything. Try to push that fear back. Try to push it back behind everything else that you're thinking about. And it's normal and natural to have worries, and you will have them, and you will have stressors sometimes, and you certainly will have triggers, and you will have things that set you off or make you feel negatively about something or about yourself. It's par for the course. It will happen. It doesn't mean that you can't get past it. Have faith in yourself. Remember that you hold the power, you really do, and even when you feel your most helpless, hopeless, and powerless, you have the power. It's in there somewhere. You just have to find it, tap into it, and let it go. Let it pour into your day. Let it pour into your life. Let it shape your recovery.